right. Hey, everybody. You're listening to Angelneers, a Silicon Valley community that brings startup builders together with experienced operators, and we share key insights on how to build and scale startups. I'm your host, Oleg Kujikov, and our guest today is Jie Feng, a co-founder and CEO of Kells, which provides accessible, high-quality dental screening through a combination of clinicians and AI. Today, we're talking with Jie about improving access and quality of oral healthcare by bringing AI into dentists' workflows, particularly when finding cavities. But before we get into those topics, Jie, welcome to the show.
Thank you for having me.
Yeah, we're excited to have you and learn some more about you. Typically, we sort of start these interviews with just kind of a get to know you with the guest. So let's get started with you. Tell us a little bit about how you got started in tech.
Sure. When I was in high school, I think that was the first time I got into computers and was obsessed about video games, and I want to know how it was built. And I just thought that was the coolest thing in the world. And one thing led to another. I started pursuing college in computer science. Really started working on artificial intelligence, computer vision during my master's. That was about 7, 8, or even like 10 years ago, and it was fascinating to kind of see the ability to put a computer to do things that like a human being, to understand these data. And so I came to US around 2012 to pursue my PhD in computer vision at Columbia University. I focus on developing algorithms to understand images and 3D data about the environment, right? I was probably a little bit early on the curve in terms of leveraging both the color images and depth images to really perceive the environment like human did. And but what's interesting in that experience is that I came to realize that technology innovation is oftentimes in the silo that it was kind of developed in an ideal situation that people think we're just pursuing technology for the sake of pursuing that. But my experience during the PhD, by interacting with business school students, developing startup programs, really gave me that incentive that, hey, you should bridge the gap between the advanced technology and the problem in the real world. So I had opportunity and really appreciate those moments that I get to talk to people outside of my circle and developing products and applications that really address real world problems, like how to prevent injuries when you're doing exercise. And that's funny because when we were doing that, we got invited to Y Combinator, and I have no idea what that is at that time. But obviously, the president of YC at that time enjoyed the demo we gave to him. And we hop on the red eye, go to California. That was my first touch there, and just changed my mindset about, hey, how technology can influence a large scale population if you actually turn it into a business. So from there, I kind of step on to this journey to build startups. Of course, I was also working at a few Silicon Valley tech companies like Google, Amazon, which taught me a lot about how big companies think about innovations, how they leverage their resource to build different kind of products and launch to the market. So those experiences benefit me when I doing what I'm doing right now.
So we're going to talk about dental. Can you tell us how you got introduced to the dental world?
I was naturally fascinated about health tech, right? Like, think about what is the most impactful areas for human beings. I think about how to prevent disease, how to identify problems early, and I was introduced to my current partner, Kevin, by a friend, Kevin was working on the dental service organization in New York, and he was talking about how labor intensive or how difficult for dentists to go through tons of x-rays to identify problems and for example cavities and other issues, and these are not that easy even for the most experienced dentist. And that kind of light up kind of an idea in my head, like why don't we have AI to help with that? Because at that point we're already seeing promising results of deploying AI to other health care areas like medical, right? But nobody is doing dental. So we start to brainstorming ideas and what is the first prototype we can build, and that's where we started. And I will tell more about like how we position what we do now, which is not typically in the dental office setup. There's a kind of a inspiration to bring that closer to the patient directly.
Let's put a pin in it. Let's talk about like the dental industry real quick, and then we'll get into Keep a little bit more in detail. In 2021, so a little bit about the market, the global dental services market grew about 19%, reaching $435 billion, with North America accounting for 35% of that growth. The market consists of sales of dental services and related dental services goods. Can you speak to kind of the main challenges today that are in the dental industry?
Yeah, so it's interesting you share those numbers. Dental industry is very deep and wide in terms of the service it provides. Regardless of all the development and capital put in, cavities and gum disease are still the most prevalent disease in the world, affecting everyone, right? And so when we think about challenges, I think the first thing is dental, especially in the US, is always perceived as a separation from other part of the healthcare system. And if you look at the coverage on insurance, not everyone has access to dental insurance. In fact, 1 out of 4 people in the US are lacking insurance access. And the kind of a perception awareness about your oral health is not part of your whole body health is a kind of a mental challenge for people to think about that, and that's from like a higher level. But if you think about the care delivery system, I think one of the things is that there's no equivalent like scientific measure about dental care quality, right? So if you go to, it's a famous thing, like if you take the same set of x-rays and you go see 10 different dentists, you're going to get 11 different answers, right, about treatments and the problem. So because of that, I think patients are naturally having these kind of concerns or fears about going to a random dentist and doesn't know what to expect. Because of inconsistency, and that leads to a lot of issues for people to access dental care, because they either they don't have the trust of the dentist, they don't have just kind of nearby access because they live in the place that no dental office is available, or in general they just don't like people drilling in their mouths, right? It's part of the nature of the industry. So I do think, I'm obviously talking more from the patient perspective, but I think they should be the center of the industry, and it's not built that way right now.
You said something interesting. Why? Can you speak? Maybe this isn't for this podcast, but why do you think we treat dental health differently than the rest of the body?
Yeah, it's a great question. I think, just personally speaking, I feel like dental health is not as life-threatening as other medical conditions, right? If you think about, okay, so you have some problem in your teeth, and I'm gonna do a filling, or I can take it out, even extract it. It's not like you're gonna lose blood or anything. It's just like you miss the tooth and put a fake one on it, and you can still do what you need to do. I feel like, there's a little bit kind of understatement on, how important dental care is, but also how the system is built to reimburse for those things, because it's very much fee for service, right? So, for people to access, they just, it's not linked to like your chronic disease or something, but actually they have a deep connection to that. So if people are not acknowledging that, so that they would just like, oh, you have diabetes, so I just need to treat diabetes. But a lot of the times, the cause for the diabetes could come from oral health. You have a poor hygiene, you have inflammations. And I think those connections are lacking here, so that in general, people just separate them out in their mind and in how the system is implemented.
So let's talk about technology. The dental industry has been slow to embrace technology. I don't know if it's slower than other healthcare areas, but in general, I think healthcare is kind of slow and careful to embrace technology because people's lives are on the line. What are the key reasons for that? Maybe I just gave an answer, but what do you think the key reasons are that maybe dental has been slow to embrace tech? I think
first thing is that dental, as healthcare in general, is very fragmented, right? So I think the number I saw is in America, probably like 30% of them are aggregated or as a DSO or practice group, and the 70% of that are still individual offices. So when you think about such a fragmented market, to be able to deploy new technology to all these territories will take a lot of time, and you will deal with very noisy kind of customers in a different level of acceptance. And particularly for dental, I think it requires. There's a lot of like when you think about new offices being built, there's a lot of debt for the students, and for them to justify investment on certain technology, they need to see a consistent returns on that, right? So if you're thinking about like AI or other technology, they have to see like, okay, it actually gives me a clear ROI that can get my money back. And oftentimes it's not that clear. This is something, it requires the whole industry to work to make it more mature. And the third part I would say is the kind of implementation in terms of integrating into the current workflow. And dental software or hardware are very kind of scattered, right? Every dental office you think about, it's a silo by itself. So everyone can have a different workflow to be able to develop something and say, it's a generic or general scalable product. You have to deal with all kinds of software, hardware, and that's not something easy to do. Also considering a lot of the legacy systems are closed platform, which means they may not have the modern API or kind of a plug and play approach for you to integrate. So I think these are some of the kind of things I personally have witnessed, and I think will probably continue be like that in the next few years and maybe even longer. So many startups have emerged in the last decade to kind of assist payers and providers in automating some of the traditionally manual parts of the business. Can you talk about some of those areas that startups are starting to address and automate? Yeah, of course. I think, first of all, I think it's a very vibrant market that a lot of innovation has happened. A lot of work has put in. Most of work are focusing on in the office side, the administrative work like scheduling appointments, run analysis to identify, revenue opportunities, your throughput, right, on the operation side. From the payer, obviously, the big part is a claim adjudication and review, detecting fraud, how to kind of speed up the reimbursement cycles. These are great applications for technology like AI. And when we talk about provider side, as I mentioned before, how to improve the consistency in diagnosis and treatment planning, especially for the multi-office providers, that's actually pretty important. And with them hiring more and more kind of fresh out of school dentists, it becomes more apparent that they can be assisted by technology to improve that baseline quality. And also, lastly, I think, how to improve the patient trust, as we just discussed. If you just like have a dentist talk to it, some people may not believe, right? They would wonder, is that actually correct or true, or you just want to oversell me something? But with technology, you can kind of build that trust and provide more evidence to communicate with the patient.
Let's move on to Kells. I feel like we've discussed the market. You seem to understand it very well. Let's talk about what Kells is doing. Can you give me the elevator pitch for Kells?
Yeah, Kells is the first step to access dental care for better oral health. How we do that is we provide the first on-demand oral screening powered by AI. It's a two-step process, very simple. First, there's a 5 to 10 minutes in-person data capture, followed by a remote evaluation asynchronously to generate a personal oral health report that you can access from your phone or any device to see a very rich and interactive experience about your potential dental conditions or suggested treatments, cost estimates, and more.
Can you talk about how the data is captured?
Yeah, so right now we're doing a X-ray capture process with a portable sensors, followed by a photo, like intraoral photos, right? So the idea is that we want to get closer to what you will get from a clinical office, but without you having to access that, right? Without you having to travel and make appointments to that. So we normally capture like four to six checkup X-rays on your bi-wings and periapicals, and 4 standard intraoral photos to just cover your whole area of the mouth.
And does the technology, does it actually determine what treatments are needed, or is it to sort of point at a problem and, identify it for the dentist?
Yeah, so we first will surface like what problem you have, like, kind of cavities, your periodontal disease, and we go further, like by kind of categorizing, for example, if it's cavity, what stage is that cavity, right? And what kind of existing treatments you have got, restorations, root canals you have got, because those are indications about what kind of treatment might be suitable for you. And then we do have a recommendation system to propose treatments based on those conditions. And right now we are having a dentist to review whatever the AI surfaced before delivering to the patients to make sure that these are correct based on human experts. And this is actually a good combination both from the speed side and the quality side.
And do you need to get regulatory clearance from maybe the FDA to run your business? So because the nature of the service is to do screening, so we're not actually making decisions to say, hey, you actually have a cavity, because we cannot check in person. I think naturally we have a lower kind of a requirements for those clearance. We do have an RRB clearance so that we can use our technology as investigational device alongside a dentist. And our goal is to actually, kind of get this cleared as an automated device, hopefully, even without the dentist being involved. Let's talk about, how the company was started. What was the insight or aha moment that kind of led to starting Kells?
Yeah, it's funny. I think there's not it's not like a single moment actually triggers that idea, but more like it kind of start to make sense when you think about different pieces, right? And I think when I grew up, I have very limited understanding or even access to dental care just because, nobody's telling me that. And I always feel like, I only go to see the dentist because I have a broken tooth, right? Or something's really bad happening. And, but when I kind of start to get into the industry to learn more about it, I feel like the preventive angle is really critical. And there's not enough voices or enough kind of a work that being put into there. It's mostly driven by treatments, right? It's all about drilling in your mouth. And at that point, and obviously, when you go to visit a dentist, they don't necessarily spend a lot of time talking to you about what kind of conditions might hurt you in the future, or they sometimes also miss things. So all these come up. I feel like that just leaves the patient very underserved, right? When I say underserved, it doesn't necessarily mean like, hey, you don't have the funding or the money to access dental care. It's more about like it's not that convenient or it's not that trustworthy to get the care you deserve. So, so I think especially with the COVID, we witnessed that people are naturally much more aware of the importance of healthcare, personal care, and they want easy access to it. And that led to our current proposition. Like we want to bring high quality dental care to the people, not just to look at it inside the office scenario, but like, how do we make it democratized so that anyone, regardless of their background or their, kind of a race, right? It's actually a quite interesting factor that affecting people access to healthcare. How do they get equal access to the same quality of care that's important to them? So that's kind of what's motivating us to do Kells.
Talk about the people. You already mentioned your co-founder. Who are you going on this journey with? Who are the people behind Kells?
Yeah, so the founding team is 3 people from very different background. And me, obviously, from technology and innovation side. My COO, Kevin Duffy, came from finance background, was also a COO at one of the largest dental service organization in New York. And our clinical expert is a veteran dentist with over 30 years experience practicing, and also a clinical kind of educational voice in the community, talking about the kind of the best practice or best way to educate patients or protocols used in the office. And we feel like this is a very complementary team. When we first got together in the dinner, it just hit along very well that everyone has something to bring to the table to make changes to the industry. So I feel very fortunate to meet my partners.
Okay, and how about timing? Timing is so crucial for successfully launching, growing a startup. So why is now the right timing for your company?
Yeah, it's interesting by just kind of, like you mentioned before, like, dental always like kind of a slow in the curve to adopt technology. And I feel like COVID has definitely accelerated that people have a mindset to like, I want a virtual care. I don't want to necessarily go into the office to get that kind of first touch. And I think the mindset of like value-based care that's been kind of a very advocated in the industry has really put us in the position to think about long-term health, right? Not just like fixing the problem right now, but like what can we do to make sure that we can like reduce the risk in the future. So that's where prevention, early detection comes in. And we feel like AI is really the pivotal kind of a force to analyze, understand the data, sometimes even better than a human expert, to surface those signals so that we can take actions on it. And there's a large kind of a population in the U.S. at least that are served by Medicaid, Medicare. There are $1 trillion spending right on these populations, and they don't necessarily have the right care they deserve. So we feel like with technology AI, it's really has a potential to equalize, kind of a service for different type of people, right? So that it's I think we think it's the right timing to take on that task, take on that challenge, and really bring some changes to the industry.
Awesome. Let's look under the hood. Talk about your technology stack and what kind of important choices did you have to make early on?
So our platform is cloud-based. You don't have to install anything. We kind of developed a end-to-end pipeline. Go from like X-rays, raw X-ray data, all the way to diagnostic findings, treatment recommendations, and generating that personalized oral health report. When we first started, I remember that there are different types of images and data we have to look into, and the first thing we said is that let's take on the radiographs, because unlike other healthcare domain, dentists take radiographs almost like every day, right, all the time. That's a bread and butter thing, and it's important to focus on kind of being really good at detecting things on those fundamental data points. So we didn't do photos initially. We just focused on X-rays and get it really good. And then we move on to other modalities. The other thing I want to say is about how we look at data. A lot of the company will tell you, hey, you need to collect as much data as possible. We agree with that, but also we put a lot of effort to improve the quality of the labeling, right? So instead of just having people look at the image and label, we actually go to the clinical notes and the history of that treatment to really verify that there's actually a finding in the X-rays. So I think those decisions serve us well by building the most relevant system and collecting the most kind of valuable data instead of just going through the volumes.
What are some of the key milestones that you've achieved along your journey to this point?
So we have launched we have completed the platform, first of all, that does what I described before. During the development cycle in the past almost like 2 years, we have touched over 3,000 patients in the office setting used by a dentist, and we have scanned more than 15,000 X-rays through the AI, surface a lot of cavities that otherwise will be missed. So we launched our service, our screening service, only this March, so 2 months ago. And but we're growing at a double-digit rate in terms of how many people we screened. There's a very clear interest and need on the market that would appreciate a scalable solution like this. And also, we teamed up with several organizations, both private and public, like WeWork, YMCA, some nonprofit, to pilot our services. And very interestingly, people are giving us very high reviews, almost always 5 out of 5, and we see like how impactful this new experience is to them. So we're very excited about what's coming next.
Awesome. Well, speaking of that, can you talk about what's coming next? What kind of exciting things are on your roadmap that you're working on, and where are you headed?
Yeah, I think we have a pretty ambitious roadmap, and obviously it's targeting both like short-term and long-term. But two things we're generally focusing on. One is horizontally, how do we scale the operations? So we're planning to basically build a more robust clinical support team from hygienist to dentist in the back end to make sure that we can serve more populations as they come in. And on the vertical side, on the screening experience itself, on the product itself, we're really excited to build the connections between the dental and medical. So, we're planning to dive into some statistics or the data that naturally disconnected, but to identify, how the dental condition or the dental profile would indicate your risk of developing certain medical conditions, right? And I think there's no clear answer to that, and it could be a very ambiguous problems, but the potential of being able to identify these gaps and prompt people to take preventive actions are really, really kind of exciting for us.
Well, let's pivot and talk about the business. Who are your primary customers exactly? Is it patients, dentists, or even insurers? And how do you build awareness among your customers?
Yeah, our primary customers are patients, right? So when we think about, obviously, the three stakeholders you just mentioned, it always comes to us that patients should be at the center of the care. And right now, they're not, unfortunately, a lot of the time. So we want to build an experience and service that really puts them to be the decision makers, the data owners that can, feel control of their own health. And we build awareness by working with other organizations that already have a robust customer base, right? So we're actually kind of a B2B2C model that we look at, where people live and work, what are the communities they interact with, and we go there. We're trying to bring the service to them so that they don't have to seek solutions, and to kind of build the educational piece, awareness piece by running these pilots and getting people to talk about how different that experience is.
Next, let's talk about your go-to-market strategy.
I think we're mostly just through partnerships, and both from the private market and the public market. We're mainly focused on private market right now, working with employers, PEOs to position as a benefit to companies that doesn't provide dental coverage, or they have very limited coverage, or even when they have coverage, these are not being leveraged as expected, right? If people don't go to a dental office, they kind of spend their money with no outcomes. So we want to bridge that gap and make it really easy for people to do some preventative actions, take exams, and kind of grow from there to touch more workforce, and building distribution channels with organizations that have connection to providers or insurers.
And what's the business model like? How do you make money?
So we charge our service kind of on the per person basis. So every time we do the service, there's a price point on it. And we make it really kind of affordable because of the technology we use. We can dramatically reduce the cost to have an on-site dentist and the time that the dentist needs to allocate to review each person, right? So that's one side, more kind of direct to the patient. The other side is the referral. Once they are screened. Most of the time, people are asking, like, can you recommend me a dentist? So naturally, we want to carry them over through the whole care cycle. So we would basically generate leads for dental providers. And we think it's a very high quality lead that people have been educated and they know they are aware of the potential needs they have to be treated. So we would basically charge from the provider side.
Well, let's move on to kind of bigger picture closing questions. Just to recap the interview so far, what's one thing about Kells that makes you stand out from the crowd?
So we are naturally in the teledental space. If you look at the market, and most of the teledental companies right now are providing virtual evaluation through photos. And we believe that photos are a great source of information, but it's very limited in terms of detecting early issues. And we are the only solutions that would bring clinical quality evaluation directly to the patients. That kind of powered by technology that would level up the results and outcomes of that process.
Talk about some of the challenges as a founder that you have. What kind of challenges keep you up at night?
Wow, there's a lot. Well, I would say probably the biggest one is really kind of thinking about how we can make things happen in the legacy system, right? I think through our conversation with people, it's kind of obvious that you will notice that people don't like changes, even though they're advocating for it. When you ask about, hey, we want to kind of shifting the operation model in this way versus the one you're using, they're reluctant, right? And there are definitely more kind of aggressive people, and they would be like, we're happy to pilot or we're happy to test, but most of them like, they think it's crazy, like it's not going to work, it's going to take a long time for people to understand that, stuff like that. So it's funny, like people ask us like, what's your competitors? I always had that mindset that our competitors is the old system, right, existing today, that we try to change it. So that's something, always obviously articulate and expands to a lot of more kind of concrete challenges about, hey, having conversations, having, people to understand your pitch, what's the price point, how do you connect with the rest of the workflow, stuff like that. But really, when we think about the big picture, those things are always in my mind, and obviously discussing with my partners and working with people outside is not that intuitive.
Mm-hmm. Wow, that is definitely a great insight. I want to ask another founder kind of question. What's your highest high and your lowest low as a founder to this point? And you said you've started multiple companies, so feel free to use your entire wealth of experience.
I think the high time is always like when you have a very creative and supportive team, right? I enjoy working with people smarter than me and always teach me about something I didn't know, I didn't think about. I feel like that is very satisfying. And the same thing when I can support team, in a way that they can amplify their impact to create things that never existed before. Those are the kind of really the motivations for me to get up early every day and get excited about the future. The low light, I think I learned is that you always wanted your theory to be true, but a lot of times they're not. And you have to be able to say, okay, I'll take that, and I would be open to opinions and kind of suggestions that would make more sense, right? So we had a lot of occasions that we just think that's common sense, everyone should be able to understand that. It's not that hard, right? But when you talk to people, you just feel like their mind is in a different place. But that's totally reasonable. It's not like they don't respect your work. It's just like they have their own context, they have their own scenarios and challenges, and we have to be on their shoes and think about, how do we make our product more relevant in their daily life. These are just a few examples, but kind of part of the journey is to adapt and kind of learn about what you didn't know before. So I think that's very rewarding.
Okay, last question here. What's your long-term goal? You mentioned a little bit earlier some of the long-term vision, but could you paint a picture for me what the long-term goal is for the future of your company?
Yeah, I think what Kells' mission is to improve oral health for everyone. And you can do that by using an existing approach to say, I want to hire more doctors. I want to, getting more fundings to support that. It's just not very scalable. And so our goal is that by leveraging technology like AI and other things, and combining with providers and experts, we can really improve the baseline of oral health for people that are coming from different backgrounds, whether they're in a different kind of a location, whether they are having different income levels, have difficulties to access care. We really want to see a world that people are equalized when it comes to healthcare, and we want oral health to be an entry point to the whole body health, right? We want to play as a kind of a voice in the industry to raise the awareness of having good oral health can actually bring long-term health to your whole body, and we believe we can do that by working with other very innovative partners in the industry, and that I think it's a really rewarding mission for all the team to work tirelessly for.
Yeah, certainly a worthwhile cause. So we're kind of at the end of the interview here. Jie, it's been great. For the listener who has made it this far and is still on the line, what would you ask them to go do?
Yeah, first of all, thank you for having me and giving me an opportunity to share what we do. I appreciate listening to this podcast. If you're interested in more about what we do at Kells and want to follow our progress, go to our website, getkells.com. We're gonna put more content into it as we grow. We're more active on LinkedIn when it comes to social, so follow us on LinkedIn. And of course, you can always reach out to me directly at jie@getkells.com.
Awesome. All right, we're going to end the show there. If you liked this episode, please subscribe wherever you listen to podcasts and leave us a rating. Thank you, Jie, for joining the show today. We appreciate your time and your insights. Thanks for sharing.
Thank you very much.